Welcome to Estella Sparks. Today, we'll guide you through the step-by-step procedure for performing a venipuncture. Let's get started. Step 1. Hand hygiene. Always start by washing your hands thoroughly with soap and water or using hand sanitizer. Step 2. Patient preparation. Ensure your patient is comfortable and their arm is supported. Explain the procedure to them to ease any anxiety. Step 3. Apply tourniquet. Place a tourniquet around the upper arm about 3 to 4 inches above the puncture site. This helps to engorge the veins and make them easier to locate. Step 4. Vein selection. Palpate the arm to find a suitable vein, usually the median cubital vein. Avoid veins that are hard or flat. Step 5. Clean the site. Disinfect the puncture site with an alcohol swab using a circular motion from the inside out. Allow it to air dry completely. Step 6. Prepare equipment. Assemble your needle and vacutainer system. Ensure everything is within reach before you begin the puncture. Step 7. Insert the needle. Hold the needle at a 15-30-degree angle, bevel up, and insert it into the vein with a swift, smooth motion. Step 8. Attach the vacutainer tube. Once the needle is in the vein, attach the first vacutainer tube. Blood should begin to flow into the tube. Ensure the tube is filled to the required level. Step 9. Remove the tourniquet. Release the tourniquet before removing the needle to reduce patient discomfort and prevent hemoconcentration. Step 10. Remove the needle. Carefully remove the needle and immediately apply gauze to the puncture site. Ask the patient to apply pressure to stop any bleeding. Step 11. Dispose of the needle. Activate the needle safety device and dispose of it in a designated sharps container to prevent needle stick injuries. Step 12. Label the samples. Label each blood sample tube with the patient's details immediately to ensure accurate identification and processing. Step 13. Final patient care. Apply a bandage to the puncture site and check that the patient feels well. Provide aftercare instructions and thank them for their cooperation. And that's how you perform a venipuncture. Remember, practice makes perfect. For more tips and training, visit Estella Sparks online.